Hello, guys. Today, the topic is fracture and its complications. First of all, what is meant by fracture and what are the causes of fracture and what are the types of fracture and what are the pathophysiology behind the fracture and its complications. Before going into the fracture, what is meant by fracture? Fracture is nothing but a break in the continuity of the bone. What are the causes of bone is causes may be direct or indirect. Direct causes by issue of trauma. Indirect causes is mainly because of the road traffic accidents causing the crushing injuries or twisting injuries or extreme muscle contractions or spasms. And what are the types of fracture is depending upon the criteria. There are several types of fracture patterns. One is depending upon the cross section of the bone, it is whether complete or incomplete fracture. If entire cross section of the bone is complete, then it is complete fracture. If it is not completely broken, then it is incomplete fracture. And coming to depending upon the fracture exposure to the environment, it is called as closed open fracture. Fracture does not exposing to the environment, it is closed fracture. And open fracture as again divided into three types depending upon the Gustave Anderson classification. Type 1 it is less than 1 centimeter. Type 2 it is more than 1 centimeter, less than 10 centimeter. Type 3 it is more than 10 centimeter. And depending upon the fracture, different there are fracture types have different patterns depending upon the how the mode of injury and the force which act on the bone and the muscle oppositional force acted upon the bone. These are all the criteria which will make the fracture pattern. One is brain stick fracture, which only unicorn, one side bone is broken, and spiral with there is a torsional force acting on it, and commuted it will be multiple number of pieces will be there. And transverse fracture, the fracture in which break across the bone at right angle to the long axis of the bone. And compound fracture is the fracture in which bone is sticking to the skin, also called as open fracture. And compression fracture is mainly a fracture caused by the compression or pressing together causes compression fracture, mainly seen in the osteoporotic bone. And avulsion fracture, and fracture which occurs as a mm, attach soft tissue attachment pulled along with the bone. It is called as avulsion fracture. And depression fracture is the bone which get depressed. And pathological fracture is there is something behind the diseased bone, either it can be osteoporotic or any pathology behind the bone fracture. And stress fracture is due to repeated loading on the bone which will cause a stress fracture. And what is the main pathophysiology of the fracture is due to any history of trauma, either it may be direct or indirect, there will be break in the continuity of the fracture which causes divided into proximal and distal fragment. This proximal and distal fragment get pulled together or displaced away from the site depending upon the muscle spasm, muscle opposition forces acting on the fracture pattern, and depending upon the velocity or whether it is low velocity, high velocity, and also depending upon the periosteum and blood vessels in the cortex get disrupted and interportion in between the fracture site is also one of the factor which will causes leading to bleeding and hematoma between the fracture fragment beneath the hematoma beneath the periosteum and forming the hematoma, and these later develop to form a bone callus around bony callus. That means bony tissue surrounding the fracture site dies, creating an intense inflammatory which releases the chemical mediators and histamines and prostaglandins, resulting in vasodilatation, edema, pain, loss of function, leukocytes, infiltration of the WBC. These are all combined together to form a hematoma formation, which there is having a different. This is a separate topic of different healing of the fracture. This start with the stage of callus, stage of granulation tissue, and stage of modeling or remodeling. These are the steps up to fracture.